Hey guys, today we're going to be talking about the nasopharyngeal airway and how to administer an airway actually inside the patient's nasal cavity. So over here we've got a couple different sizes of nasopharyngeal airways, or NPAs. So we can see that we've got definitely all the way up for our NPAs for our bigger patients, all the way down to our tiny little patients, our little itty bitty nasopharyngeal airways. So when we're using these, we want to make sure that we select the appropriate size for our patients. Now, in order to do that, right, we actually size it in two ways. Number one, you size it from the tip of your patient's earlobe, right, all the way up to the tip of their nose. And so you can see here that this one's sized pretty appropriately that we can see. The other thing that we want to do, right, is we actually want to make sure that it fits the patient's nostril. You don't want it to be too big for your patient's nostril. You also don't want it to be too small. So we're going to make sure that it fits inside your patient's nostril. In order to size it that way, you just hold it right up next to their nostril, make sure that it does look like it's going to fit. You don't want to force it in. Next thing we're looking at, you guys, is we want to make sure that this is appropriately indicated for our patients. Now, we can put this in any patient who's actually awake, is alert, and even a patient who's talking. You could put this right into my nose right now. It's not going to be comfortable, but you could do it. This is good for a patient who's maybe doesn't have a good intact open airway. It helps direct air behind the patient's tongue. So in this situation, what we're going to do is we're going to insert it into our patient's nostril and keep that airway open. Now, any patient who's got any facial trauma or potential basilar skull fracture, a fracture of the bottom part of their skull, this is contraindicated in. Right? We don't want to insert this into a patient who's got a fracture or any facial trauma. Now, when we're going to insert it, we want to make sure that we appropriately lube it up before. So we're going to go ahead and just get a little bit of some sort of water-based soluble lube on there. And then we're going to insert it in. Now, when we insert it, it's really important to remember, you guys, that the bevel here, right, needs to face the septum. The septum is the middle part of the nose. So that bevel should always face the inside of the nose. That longer part right there should always face towards the outer part of the nose. So what we see is when we're putting this in, all right, we want to make sure that that bevel faces the septum. Now this is really easy. Once it goes in, you guys, it just actually slides all the way back until that flange rests against the patient's nostril or even their nair. Now that's how you insert into the patient's right side or right nostril. Now remember, that bevel always has to face the septum. So if we're going to go in this way, you can see that it looks like it's going to be kind of upside down here. So what we do is we insert it in, bevel towards the septum. We go to about halfway back. Once we're halfway back, we actually flip that thing around, right? Turn it 180 degrees. And now push it all the way back in again until that flange rests against the patient's nostril. That's how to insert an NPA or nasopharyngeal airway.